everyone. I am Dr. Hakim Irfan Showkat. I'm a Director and Chief Interventional Cardiologist at Srinagar Medcity Heart Institute based in Kashmir. So today we'll be discussing briefly about ambulatory blood pressure monitoring and its importance. As we all know that hypertension is the most prevalent disease, particularly in our country and in this region, and the diagnosis is very important for this. And ambulatory blood pressure monitoring, which is a 24-hour account of the patient's state, and is useful for diagnosing primary as well as a secondary hypertension. And it is the only modality which can differentiate between white coat and masked subtypes of the hypertension. So it has a very accurate predicting the risk of cardiovascular disease and mortality. Because if we diagnose the blood pressure early and accurately, then only we can risk stratify accordingly and have to treat the hypertension as per that. So BP level measurements using home or ambulatory BP monitoring is recommended in patients with office BP classified as high normal BP or grade 1 hypertension or diastolic where the systolic blood pressure is above 130 and diastolic is above 85. So recent guidelines have changed. So, but today the ABPM provides the average of BP readings over a defined period. Usually we take it for 24 hours. The device is typically programmed to record BP at every 15 to 30 minutes intervals. And during night, we can increase the duration to around 1 hour. And the average BP values are usually provided for daytime, nighttime, and overall in 24 hours. So these all the activities of the patient, and during sleep time, we can accurately record what is happening with the blood pressure. So a minimum of 70% usable BP recordings are required for a valid BP ABPM measurement session. The values are on average lower than office BP values, and the diagnostic threshold for hypertension is 130/80 over 24 hours and 135/85 for the daytime average and more than 120/70 for the nighttime average. So all equivalent to office BP of around 140/90. What are the advantages of this 24-hour BP monitoring? It is a better predictor of hypertension-mediated organ damage than only the office BP. The 24-hour ambulatory BP monitoring mean has been consistently shown to have a closer relationship with morbid or fatal events. It's a more sensitive predictor than office BP of cardiovascular outcomes such as coronary, morbid, or fatal events, as well as stroke. It can easily identify and differentiate between white coat and masked hypertension. It has a stronger prognostic evidence, though nighttime readings, which can be only measured through ABPM. Measurement is in real life settings, it is not virtual. Additional prognostic BP phenotypes can be done through ABPM only. There is abundant information from a single measurement session, including short-term BP variability. So the BP variability also is a predictor of cardiovascular morbidity, and this variability can be diagnosed only by ABPM, and we can also have the 24-hour smooth control of blood pressure on the medications. We can only have that with ABPM. So disadvantages, it has some cost whenever we do it, but overall, if we see, it can reduce the pill burden. So that way it is not costly, but yes, sometimes it has to, there is some pressure on the pocket, and very rarely it can be uncomfortable to some, but not all. So it has become an indispensable tool in the diagnosis and management of hypertension and its therapy. So the recent guidelines, we know that ESC recommended the diagnosis of hypertension should be based on repeated office BP measurements or ABPM if economically feasible. So analysis of various indices on the ABPM graph such as hyperbaric index, diurnal index, dipping, and other indices can provide useful information about the prognosis of disease such as hypertension, diabetes, CKD, and so on. It can also be used to monitor the therapeutic efficacy of the antihypertensive treatment, because only this way we can measure accurately how smooth the blood pressure is throughout 24 hours. In addition, ABPM is the single most effective tool to diagnose white coat, masked, and nocturnal hypertension and can help direct the treatment in such patients when required. Even during the night time, some patients are non-dippers or some are super dippers. So we may accordingly have to change the dosage or even the timing of the medication. That can be only provided by ABPM. So the overall ABPM readings can guide towards the prognosis of underlying organ damage and can be a useful predictor of cardiovascular risk. So overall, if we say that how good and how frequently should we use ABPM, In my routine practice, I very oftenly use ABPM, particularly in the young population, where we should have accurate diagnosis, where we should have good control of blood pressure, and where we should accurately know what is the diurnal variation and accordingly have to give the dosage of the medication, or even the timing of the medication can be provided by the ABPM. So I think this is a very valuable tool and should be more frequently used by all physicians, and cardiologists are quite often use it. I thank you, Lupin, as well as other colleagues who provided this opportunity to talk about this important tool, and particularly for the benefits of the patients. This information is important for overall general population. Thank you.